Hello and welcome to Coronavirus Report. I'm C.A. Murray. With me in the studio, Pastor Stephen Bohr, the speaker, president of Secrets Unsealed, our resource person and chairman of the board and health officer for nearby Kings County, Dr. Milton Teske. Gentlemen, good to be here with you. Things are happening, things are changing, we're getting news, we're getting information, so we need to give them as much as we possibly can. And I know to sort of steer the conversation just a little bit, we wanted to complete our discussion on lifestyle, because we haven't spent a lot of time talking about how to keep yourself fit so that you don't catch this in the first place. We talk about what happened when you got it and what happens when you go to the hospital and some other things, but we need to complete this discussion on lifestyle, because that's equally important to put yourself in a position to have something to fight with when and if you have to fight.
That's right.
Yeah.
I want to read this statement again, Dr. Teske, because some people might not have tuned in on the previous program. This statement by this great health educator who actually wrote 115 years ago a book called The Ministry of Healing. And, there's 8 so-called natural remedies that are mentioned in this quotation. But the part that I really want us to focus on is perhaps the physiology aspect. So this is the statement. It's found in the book Ministry of Healing. Pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power, these are the true remedies. Every person should have a knowledge of nature's remedial agencies and how to apply them. It is essential both to A, understand the principles involved in the treatment of the sick, and B, to have a practical training that will enable one rightly to use this knowledge. Then comes this very important paragraph. The use of natural remedies requires an amount of care and effort that many are not willing to give. Nature's process of healing and upbuilding is gradual, and to the impatient, it seems slow. The surrender of hurtful indulgences requires sacrifice. However, in the end, it will be found that nature, untrammeled, does her work wisely and well. Those who persevere in obedience to her laws will reap the reward in health of body and health of mind. Now, the big question is, Dr. Teske, as I see all these advertisements on television, I'm not going to mention any specific one, they seem to deal with symptoms rather than the disease. And they'll take care of one problem and then they'll create another 25 or 30 problems in side effects. So is there a better way?
Over the years in the emergency department, as I deal with everybody's problems that have gone wrong, and whether it's the heart, the lungs, the blood system, the immune system, the digestive system, and all the things that we try to do for it, everybody is focused on meds, on the right medicine for this, the medicine for that. And the training today, I notice it more so in the younger doctors than some of the older doctors. And I suppose maybe I'm older now. I've seen all the things that don't work. And you realize that almost all of the meds we use treat symptoms rather than the disease. Just take something common like high blood pressure, which is one of the high risk factors for getting bad case of the coronavirus. If you've got high blood pressure, you're at high risk of things going bad. But there are probably over 1,000 different blood pressure medications that a doctor can prescribe. Wow, there are several dozens that are the most common ones right now, and they don't take the trouble to use all the others because there's too many to even anybody to remember that many different. But there's that many different medicines out there to control blood pressure. But you have to remember that blood pressure isn't a disease. Blood pressure is a symptom. The underlying disease is a condition of the arteries. the hemodynamic system in the body that's pumping the blood through these arteries, and the arteries have this resilience where they give, and we get this hardening of the arteries where they can't do it. Various metabolic derangements, in the salt balance in the blood can affect it. There's a lot of things that are going on there, but the medicines we use don't treat any of that underlying physiology. What the medicines do is try to drop the blood pressure. And we can give you diuretics to drop it. In other words, we can dehydrate you. If I dehydrate you bad enough, eventually your blood pressure will drop. So we'll try to give you just enough to make it a little lower, but not, hypotensive. There is medicines that work on the hormones that they come from your kidneys, and they control how your blood pressure runs. And there, are blockers that block the things. You constrict and dilate your blood vessels to control the blood flow in your body. And we just give things that block the message so the things dilate. Well, if you dilate every blood vessel in your body, you'll pass out real quick. So we just try to dilate it enough to try to make the pressure go down. So we're just doing all of these various things that are just trying to treat the underlying symptom. And it's the same diabetes. High blood sugar isn't the disease. High blood pressure is a symptom of an underlying metabolic problem in the cells. And we can go on thing after thing after thing. And as long as you keep chasing the symptoms and don't deal with the cause is still there. Yeah. And its underlying damage to the bodies keeps going on. I like to use the example in the ER that the most common emergency surgery in this country is an emergency appendectomy for somebody with acute appendicitis. The symptom of acute appendicitis is severe pain right down here in the left lower quadrant. And you come in with the bad appendicitis, I could give you enough morphine, start an IV, give you enough morphine or Dilaudid, I can make your pain completely go away. I can even send you home with an oxycodone to keep your pain away.
Doesn't fix the appendix, does it?
No, what would happen? I mean, I wouldn't have done you a favor if I did that, right? You would say, this is malpractice, to do that. No, what I need to do is pick up the phone and call the surgeon and say, hey, we've got an acute appendicitis. We need to get this person to the operating room. I need to get antibiotics started to start, fighting the infection that's in that inflamed kidney. So you need to go back and treat the cause. If you don't, it'll continue to worsen, swell, the appendix will rupture, and infection spread throughout your abdominal cavity, and your risk of not surviving would become much higher. So it's important to treat the underlying cause. And for so many of the diseases that affect us, particularly those diseases we find are the diseases that predispose you to bad outcomes with the coronavirus, are diseases that are caused by lifestyle. One of the things we talked about here is diet, and that plays such a huge part in it. The diet underlying diabetes, type 2 diabetes, which is 95% of the diabetes in this country, is caused by a calorie overload along with a lack of exercise. And the same can be said for arterial sclerosis, this hardening of the arteries, the building of all these cholesterol and fat deposits in the artery wall until they rupture and cause heart attacks and strokes. And high blood pressure is part of that picture. And we can go on, all of these metabolic diseases that we talk about here that are so prevalent in America and are so much a cause of problems even before we had coronaviruses, and now they just predispose you to, bad outcomes with the coronavirus, are all related to the American diet, which is high in animal products, it's high in fat, high in sugar. It's, a junk food diet, very low in fruits, vegetables, and dark greens, which really should be emphasized in the diet.
So basically, what needs to be emphasized is health education rather than health care.
Yeah, as our quote here talked about, the importance of educating and of the time and effort it takes to actually learn this natural methods of healing, natural methods of treatment. Nobody today knows anything about hydrotherapy, the hot and cold treatments that were, you know, one of the things that was a real mainstay back in the early days when we didn't have all these drugs. People did those things because, well, they actually worked. They actually helped a lot. And of course, with all of the information we now have on diet, it's still extremely difficult to help someone change their diet. That's probably one of the more difficult aspects of dealing with anything here in the healthcare area is diet, because diet is cultural.
Yeah, and I was going to touch on it. It's assumed when you go to the doctor, or it seems as though the doctor assumes you don't have the self-discipline to make the kind of systemic changes that are going to help you. So rather than try to impose a discipline on you that you cannot impose on yourself, I will give you something that will allow you to keep your lifestyle and just mask the symptoms. And of course, things are getting worse. One of the things about medicine today, it seems to lean in the direction of not having you to disturb your regular course of acting too much and try to keep you as well as I can without rattling your cage too much. You know, we're not going to make you change because you're not going to give the discipline. Give me a pill, I can eat what I want and carry on.
Yeah, and not only this lack of, hey, I don't believe you're going to change, so why waste my time trying to tell you how to change? It's also driven by the economics in medicine today. Doctors are required to see patients faster and faster, limited time. You've got just this very short interaction. In that short interaction, you don't have time for the education necessary to help someone make a cultural change. We don't realize how much the diet is not just a rational choice. It's what our parents ate and what our community around us ate, what we are raised to eat. The diet is very much a part of our lifestyle, our cultural. When we socialize, we eat certain foods as part of that social event. And all of these things are part of who we are. They're part of our identity, probably a very major part of your, you might say, your character, your personality, are all of your cultural dietary preferences. And the foods you like, and the foods your friends like, and the foods your family likes, and what tastes good to you. And to change that is going to take quite a bit of effort to run against the grain, you know, to change that. It really takes effort. You know, one of the things that has been very effective, you know, in the past, and there are places doing it today, is setting up what they used to call sanitariums, but today we call them lifestyle centers, health centers, and where people come and they actually stay there for a period of a couple of weeks or more, 2 or 3 weeks, sometimes longer, depending on the programs at these places. Some of them have experimented with doing shorter programs, but they don't work as well. It takes some time to help people adjust their taste, to come into an environment where, here, let's try the food. And day after day, you actually eat the food, get on that program of exercise, actually get that full, you know, night's sleep every night, which uninterrupted. And we start doing all of these various things. We've got people there that are specialists in massage and specialists in hydrotherapy, the water treatments, and all of these things to enhance and bring the body back to where it was meant to be. It takes a while to get all of that stuff out of the system and to make those changes, but it's amazing. The results they are seeing at the places that are doing this type of thing are phenomenal. Diabetes, 50% of the diabetics, and these are usually severe diabetics because most people don't pay to go to one of these places if it's not bothering them. It's when they start getting the renal symptoms and the vascular symptoms, and maybe it's affecting their eyesight or, you know, some other organ system. They've got a bad heart from it. Now I better do something. You know, I've already had a TIA. I don't want a full stroke. And now they're motivated. They are getting, when they're diabetics, 50% of those diabetics by the end of 3 weeks are 100% off of all medications and insulin with a normal sugar. There's no pill that does that. And
no side effects.
the side effects are you feel really good. That's one of the side effects.
I mean, negative side
drop
effects.
some pounds.
Yeah. The side effects are when the body starts working properly, it feels good. The brain feels better. Your emotions feels better. Getting that full night's sleep, getting the sunlight, not having the brain clogged with all of the chemicals and drugs that were in these things. People feel better. Things are better when they do that. Hypertension, we were mentioning earlier, they get the same type of statistics on hypertension. Within 3 weeks, 100%, or I should say, within 3 weeks, 50% are 100% off all hypertensive drugs with a normal blood pressure. Now, I didn't mention the other 50% are improving, but they may still be on certain medications or a little bit of insulin or, you know, one blood pressure pill or something there. And, but the interesting thing is they follow that out and do follow-up. By the time you get a couple of months out, and if they stay on that same program that they've learned there for several weeks, and stay on that, we're up to some places around 80, 85% that are actually all the way off of their meds. In other words, these major disease systems like diabetes and hypertension, which seem to be fundamental to so many of the ailments and, you know, more serious things we get, are completely reversible with changing the diet, exercise, sleep, lots of water to drink, all of these things. And one of the advantages of these lifestyle health centers is that you can do it safely under physician supervision. We get dedicated, you know, some of the doctors at the Weimar Institute, some of you may know of, I've worked closely with many of them. Just an excellent job they do. They're so dedicated, and they're intelligent in understanding modern medicine, drugs, and lifestyle medicine. Because you can't just go out and throw away these pills and think things are going to go okay. You're going to have serious withdrawals, side effects of then discontinuing them. Or if you discontinue something too rapidly, the underlying disease symptom that it was treating, you know, the underlying is going to flare up, and there can be complications and problems. So it helps, you know, when you're on lots of medicines to have a physician to oversee when we cut back on this, when we discontinue this one, when it's safe to do this, and help, you know, so to speak, hold your hand, follow you through, check your blood values, you know, check your values, all of this stuff as we're going along to give you a real individualized, controlled program. So it's one of the things I'm really excited about here at Secrets Unsealed. A year ago, the board approved the idea, the concept for us to go ahead and start a working group moving towards getting a program, finding a location, and getting a lifestyle center here as a key part of the ministry here at Secrets Unsealed. This healing ministry is so closely connected with the spiritual aspect that we have so long emphasized here. It needs to go together. It's the right hand of the gospel. Christ spent more time healing the sick than he did preaching. And we need this healing modality to come in here. When people come because they're sick, because they're hurting, and we can show them that God has a healing plan for them, it's much easier to see that he also has a healing for their soul, for the spiritual qualities in life, for their character, for their life. All of the aspects of the life can be healed and turned around with God's intervention, with God's power. And God does work with us when we cooperate with Him.
Amen.
And when we cooperate with His way of doing things.
Well, you know, Dr. Teske, Secrets Unsealed began as a production ministry. Basically, we produce programming to send to 3ABN and other television stations. Then, 2 or 3 years ago, we decided that we would become a broadcasting ministry, which now we have a 24-hour SUMtv television channel and one in Spanish, SUMtv Latino. Now we're planning on doing something that is going to require a lot more effort and a lot more planning, which is establishing this health center that you were referring to. And I think it's a great challenge. It's a dimension that we don't have now, which I think is crucially important for Secrets Unsealed. And we're thankful that you are the board chair. We have 9 members on our board, because you see both sides. You see the importance of the theological side, and you see also the importance of the physiological side. Can you give us a little report on the status of this idea of establishing a health center? Where are we at?
Okay, so we've got a working group of individuals, a number of physicians, nurses, nurse practitioners, dietitians, and just other dedicated people that believe in this type of a concept of this health center. And we have been formed a informal working group, and we have been meeting a number of times. And we have spent time in those reviewing the various councils that we have, guidelines, and looking what others have done, and coming up with plans for a program, as well as a very important part is a location. This type of a ministry depends on a facility in a location, and a lot of counsel and advice on this quiet country location, but good access to the populations so that people can easily go there. I mean, we can't be far out in the wilderness. For us here, we want it close to this center here because that's the group we're working with now. You know, this is where we're physically located, and this needs a physical location to operate out of. And so we want something close to the Fresno area. We're looking for something up in the Sierra foothills, something above the heat and the smog and the fog of this valley that we who live in the valley suffer from. We want to get out of that, but we don't want to go so high in the high Sierras that the air is too thin and snowed in really bad during the winter. So something in the foothills, something that would be conducive to orchards and gardens so that we can provide not only an environment to go out and work in that type of a setting, but actually produce at least a portion of the fresh fruits and vegetables that we will serve the people, help them to see that connection, and learn to grow their own gardens. Want that to be part of it. You know, we'd like to find a facility that has a lot of stuff already in place that can be modified rather than the expense of brand new construction. And there is one place that has come to our attention we're closely considering and looking at. There's some real barriers and hurdles towards moving towards that, and so we feel the Lord is moving. We're just waiting for the Lord to work some miracles and open that door for us. And
Hey, he opened up the Red Sea, didn't he?
yeah,
And the Jordan River.
And the Jordan on the
right.
other end.
And so we're trying to be as the Caleb and Joshua, the spies that says, yes, we can do this. We don't want to be among those that say, no, this will never work. This is impossible. Because as you start to look at it, you find all kinds of obstructions and impossibilities, and this will never work, this can't work, this won't work. You know, this is the work that God has given us to do. We have a lot of counsels that says, this is God's plan. This is what we're supposed to be doing. Then we have to believe that he does have a spot, that he does have a plan, and that will be there. And I'm quite certain that he will show us, he will open that door, things will get there. And
I think there's some exciting things on the horizon based on our personal conversations, which we're not going to divulge all of the information now, but there are some promising things that are happening, which I think, in fact, I know that God is leading. And we're praying that the Lord will intervene and that He will make it possible for us to get this place so that we can establish the health center. Mm-hmm. And also, we are praying that the Lord will provide the personnel, because it not only requires a place, it requires the funds, and it also requires the right personnel for it to function well.
Yeah, that is one of the keys. If you have the right people, the program will be right. Mm-hmm. If you have the wrong people, even a perfect facility won't make it the right program. Yeah. Right, yeah. So that's really going to be key. So far, we have a number of individuals here locally that are quite interested and hopeful that I think are going to be key people. Amen. But God may have someone else somewhere, you know. Mm-hmm. Some of you listening may actually feel that God is calling you. Pray about it and see if you're the right fit and for this type of work. There's going to be a lot of work that's going to need to be done, a lot of different talents and skills to bring a facility like this to come together, not just those that are directly involved in the program, but just keeping everything else running at a place like this so that it can be the type of facility that God would be honored by. And from the grounds, the buildings, everything, you know.
Three elements: location, personnel, funding, and we really strongly need to pray for those three areas.
Indeed. This ministry began in the back of a church. It wasn't a studio. There wasn't all of this equipment, all of these lights, all of these cameras. There was a will. And the Bible says, if you be willing, it's acceptable. Amen. We got the will. We want it. Yeah. And we believe we're walking in the Lord's will. So now it's up to God. A place has been seen, has great potential, and now it's in God's hands. And I think if we pray and put it in the Lord's hands, the Lord is well able to carry it. Amen. And to take us where He wants us to go. Yeah, yeah. Well, our time has slipped away from us. See us again next week. We'll be here, you be there, and we'll give you more of Coronavirus Report.